So that completes the environmental racism part of the tribunal. We are now entering into count 5, the last count of this historic indictment, the count of public health inequities. And we're going to start with a pre-recorded video hearing from Dr. MaryLouise Patterson, who is a board member of the Physicians for a National Health Program. And in the tradition of carrying on the tradition, MaryLouise Patterson is the daughter of the famed William Patterson, who helped to spearhead the original petition, We Charge Genocide, 70 years ago. So we will now hear the video of MaryLouise Patterson, and she will be, her examination will be directed by Corey Purnell, student attorney with Howard University, Thurgood Marshall Civil Rights Center. Thank you.
Hello, everyone. My name is Corey Purnell. I am a student attorney at Howard University School of Law Movement Lawyering Clinic. I'm going to be introducing you all to Dr. MaryLouise Patterson. Dr. Patterson's father, William Patterson, was one of the initiators of the original We Charge Genocide petition. Dr. Patterson is going to be discussing several issues today. First, she's going to introduce herself and discuss how she is connected to this case. Secondly, Dr. Patterson is going to discuss how racism and healthcare tie into genocide. Lastly, Dr. Patterson will discuss what can we do about healthcare and racism today.
Good evening, everyone. I'm here tonight representing my father, William L. Patterson, who dedicated his entire life to the valiant struggle against racism. 70 years ago, he co-authored and courageously advanced a petition that charged the U.S. government with genocide. For what other label would accurately describe the near annihilation, then betrayal, banishment, erasure of the remaining First Nation peoples, followed by the stealing of their children, and/or the 400+ years of terror and indescribable heinous brutality of the offspring of the millions of violently kidnapped Africans, and/or the racism and discrimination of Latinx Americans who fled here because of impossible living conditions in their home countries, conditions created by the US Capitol and enforced by the US military. There is no other label for all of those crimes other than genocide. So happy 70th anniversary to We Charge Genocide. And thank you, Dad, Paul Robeson, and the many other courageous comrades who, by signing that petition, put their lives and the well-being of their families on the line. Incidentally, they also highlighted how genocide practiced at home was a central ingredient of US foreign imperial policy. I want to thank everyone on the organizing committee, especially Matt Meyer and the Spirit of Mandela Coalition, who have grabbed the charge of genocide baton and are carrying it forward. I've been asked to talk to you tonight about racism in healthcare. I know all of you recall Dr. Martin Luther King's statement about healthcare in this country. He said, and I quote, "Of all of the forms of inequality, injustice in healthcare is the most inhumane." But I know I'm preaching to the choir. All of you know only too well that there is racism in healthcare, that glaring healthcare and health inequities and disparities exist. For how could they not? All of our institutions, healthcare institutions included, our entire culture, this country's founding laws and practices are supersaturated with racism and have been since the arrival of Europeans. Racism and white supremacy are essential requirements in our daily diet. Like calcium is for our bones and vitamin A is for our vision. They're as American as apple pie. Everyone who grows up in this country is negatively impacted by this poison. And like poison, when doled out daily, isn't necessarily immediately lethal. Rather, it steadily and stealthily rots us from the inside. I don't think I have to tell you that there is not one healthcare index that African Americans, First Nation or Latinx people don't suffer from worse. But we can't leave poor whites out of this picture. Yes, poor white people also have poorer healthcare indices and outcomes than their richer relatives, as they only have to be dispensed slightly better, or what appears to be slightly better healthcare than what is dispensed to African Americans. Healthcare is not only racialized, but monetized as well. But then you know that too. So we can't leave the white middle class out of this. They can't pay their astronomical hospital or prescription bills either. In fact, the alarming increase in bankruptcies from exorbitant healthcare bills is highest among the white middle class. Institutional and structural racism is reflected in discriminatory healthcare policies, in the underfunding of preventive care, in the fewer and poorer quality healthcare facilities that are chronically understaffed and under-resourced, in the rationing of care, in racist curricula in medical nursing and social work schools, in fewer doctors and nurses of color, in the denial of or limited access to the latest treatments or best medications, in the inaccessibility of long-term care, in the leaving out of government coverage for glasses, hearing aids, dental care, in the implicit biases, prejudices, lack of respect, and common courtesies heaped upon and endured by patients of color. All of these, along with the detrimental impact of the chronic exposure to elevated stress hormone levels, plus, are culpable in the existence and persistence of the racial disparities, the greater morbidity and mortality from acute and chronic illnesses, and the negative healthcare outcomes so well documented in the scientific and popular media. Yes, Latinx, American, African American, First Nation, Indian Americans, and Pacific Islanders, infant mortality is more than thrice that of whites, and our maternal mortality is more than twice that of whites. Our longevity is at least 7 years less, not to mention the poorer quality of that longevity. What about the undisclosed or forced sterilizations of thousands of Black women in the South, Indigenous women on reservations, and of women in Puerto Rico, which is incidentally predominantly Catholic? Or the profiteering off of Henrietta Lacks's cancer cells, or the Tuskegee syphilis experiment. Then there were the partial lobotomies of incarcerated men, mostly men of color, African American men, in maximum security prisons up until the 1980s. Now, we not only have mass incarcerations of teens and adults of color in this country, but we have the recent expose of the decades-old dark ages system of mass incarceration, including solitary confinement of Black children as young as 8 in Rutherford County, Tennessee, on charges that didn't even exist, to name just a few racialized medical and mental health crimes. Of all the socioeconomic determinants of health, segregated housing, overrun with vermin and mold, overcrowded and deteriorating, is the worst, as it creates unhealthy and unsafe neighborhoods. In our communities, garbage is infrequently collected, streets infrequently cleaned. Few, if any, parks or playgrounds exist, but somehow guns and drugs are plentiful. Permanent physical and brain damage from lead is delivered right out of our kitchen and bathroom water taps. The air we breathe is highly polluted thanks to the greater number of industrial plants, waste treatment centers, and highways that surround our neighborhoods, which cause middle of the night mad dashes to the emergency room for asthma attacks and other lung and heart diseases. And it marks our premature deaths. I can't emphasize enough the physical and emotional psychological toll from the inescapable daily exposure to all that, plus all other manner of overt and insidious racist expressions, actions, policies, from racist police brutality to healthy food deserts, to dilapidated, underfunded, and under-resourced schools, to generations of unemployment and or employment in the most dangerous and dirty jobs, to homelessness, poverty, and hunger, while images of a pretty, clean, safe, fun life and beautifully decorated home are flaunted every night on our TV. For many of us, that life is only a few bus or subway stops away, but we can't have it. Doesn't all of that reflect the partial destruction or annihilation of a people? I contend it does. Or just ask Serena Williams if income and fame is protective for African Americans or for those discriminated against based on color or national origin. Do you remember the dangerous postpartum course she had? With all her money, celebrity, and white father of her newborn, she almost died in the immediate postpartum period. Or ask the 19-year-old bereaved son of Dr. Susan Moore, a 52-year-old African-American woman and an internal medicine doctor who died of inadequate and delayed proper medical treatment of COVID complications she was experiencing. She bravely shared with us what was happening to her on a self-made video from her hospital bed, where she pleaded for help, recognizing that she was being mistreated. She was dumped out of that hospital after speaking out and died 2 weeks later after being admitted into another one. What gets less attention, but is equally horrific and important to know, is what's happening in mental health. Did you know that 1/3 of African American patients needing mental health services never get them? And those who do usually wind up getting them in the emergency room, so their care is interrupted and episodic. When exhibiting the exact same symptoms as whites, African Americans are more likely to be diagnosed with psychoses, like schizophrenia, rather than with mood disorders, like bipolar disease. In other words, they are more likely to be misdiagnosed, which leads to receiving the wrong medication. We're more likely to be deemed more severely ill, therefore hospitalized more, and prescribed higher doses of antipsychotic drugs that have greater negative side effects. African Americans with mental illness are incarcerated at much higher numbers than whites. There are far too many Americans who didn't know or didn't want to know or just weren't paying attention because it wasn't that important to them that racism existed in healthcare. Unfortunately, it took the COVID-19 pandemic to make that undeniably clear, that racism and the profit motive in our healthcare system or non-system produced the frightening and criminal death and overwhelming illness toll we witnessed, and which some of you may have suffered over the past year and a half. Over 700,000 dead, over 100,000 children left without one or both parents. I repeat, over 100,000 children have been left without one or both parents, and most of those children are children of color. The nightly TV news, our daily newspapers, and the radio stations all broadcasted COVID incessantly. It dominated our social media, as did the fake news and lies. We saw the inadequate and incompetent federal response, with the president at the time deliberately pitting states against state in policy implementation, acquisition of PPE, gloves, and other medical equipment, the bodies piling up, the impromptu morgues, the mass confusion and fear, the chaotic and discriminatory distribution and delivery of the vaccines, causing an alarmingly high impact on communities of color, unmasked the woefully pathetic condition of our racist and for-profit healthcare system. Some of us thought the demand for a national healthcare system, or at least Medicare for all, would become easier. In cities across the country, weren't we banging pots every night in a show of support for our beleaguered healthcare workers? Wasn't COVID making it painfully clear that our self-proclaimed world's greatest democracy had not only denied us a truly functional national public health care system capable of responding to a pandemic, but instead gave us an unfathomable number of dead, overrun and depleted hospitals and a totally exhausted and demoralized healthcare personnel. Surely out of this nightmare would come a deafening public outcry for the creation of a free national healthcare system like all the other industrialized countries have, and many non-industrialized countries as well. So I started this talk saying we all know that healthcare disparities based on race, income exist in the United States, and that wasn't going to be news for any of you. In fact, I suspect many of you may have read Medical Apartheid by Harriet Washington, in which she describes the inhumane experimental surgeries and medical treatments, tortures really, as they were usually done without any anesthesia, on unwitting and unwilling Black people from the colonial period up to the books publishing in 2006 and republishing in 2008. Well, many of those experiments ended in the implementation of new surgical and or gynecological treatments in use today. Well, what can we do about racism in healthcare? The answers are beyond this talk, but one step those who live in New York State can take is to fight for the New York Healthcare Act pending in the New York State Legislature, which would provide free universal healthcare for all those residing in New York State. And if you don't live in New York State, then join the national fight for national health care or Medicare for all, the achievement of which would level a serious blow to racism in healthcare as we know it. Thank you very much.
Ancestral spirits are surely, surely part of this tribunal. I'm sorry, I'm just overcome. The daughter of William Patterson. We will now hear the testimony of Abdul Hafeedh ibn Abdullah, who is a phenomenal public health advocate from North Carolina, whose testimony will be directed by Howard University law student Liana Alston. They will both be live via Zoom. Law student Liana Alston. They will both be live via Zoom.
Good to see you, sister.
You too. Good afternoon, Mr. Abdul Hafeedh ibn Abdullah, international jurists and members of the community. May it please the court, my name is Liana Alston, and it's a privilege to be here with you today as a student attorney with the Howard University School of Law's Movement Lawyering Clinic. Mr. Abdullah, would you please state your full name for the panel?
Yes, ma'am. So, Bismillahir Rahmanir Rahim, in the name of Allah, most gracious, most merciful. I'd like to first say Assalamu Alaikum, may peace and blessings be upon all that's present today. So my name is Abdul Hafeedh Muhammad bin Abdullah, and courtesy of the inhumane legacy of slavery, it's important to note that I was birthed the name Scotty Alonzo White, which is a European name. And this name change, I just want to make sure people understand, was a political, spiritual, and cultural act in opposition to the actual genocidal practices of ethnic cleansing, where, you know, in order to sustain the people in a state of domination and exploitation, you must first take their nutrients and take their sources of resilience from them. Our culture and our identity was that. So, thank you.
Absolutely. Thank you for sharing that. It's beautiful. So, would you please summarize for the panel next the work that you do?
Yeah, absolutely. So, the verse that I come here in the capacity as a Wazir Ilam, which is the Minister of Information for the National Jamaat of Sheikh Uthman Danfolio here inside the lands of America. And I'm under the direct jurisdiction of Amir Mustafa Ahmadu Baba, who's our national Amir, and our beloved brother and befriend and comrade, Sheikh Jihad Abu Mumit, invited us to be here to give testimony today. And the work that I'm involved in is in violence prevention. When we think about violence prevention, we're thinking about interpersonal violence, and we're thinking about structural violence. The interpersonal is about the healing and the restoring, and the structural is about positioning ourselves to actually stop the systemic practices that we know are the root causes of why certain populations, Africans who've been enslaved in these lands, as well as indigenous First Nations, while they're involving in this kind of act of harming themselves, right? This is not a natural thing. So the work that I do is taking indigenous ways of knowing, right? By way of lived experience, my personal experience, living through certain eras in history, which we'll talk about here later, as well as trying to reconnect back to traditions that's pre-colonial and allow those traditions, the way that I'm seeing, in order to come up with solutions utilizing current tactics within Pacific public health that are consistent with our ways. So I was blessed with the opportunity to be connected with a program out of Multnomah County Health Department inside of Portland, Oregon. It's the Center for Disease Control Prevention program. It was a national initiative to address violence as a public health priority. While I was there, I was hired and trained as a CHW, a community health worker. While in that, and that was through the health lens, while in that capacity, we was able to develop the community health worker and violence prevention model. And it was coupled with a comprehensive strategy to address violence, multiple forms of violence, right, within a comprehensive environment, right? So after leaving that program, I was able to go to Portland, Wilmington, North Carolina, and Multnomah County kind of shifted in a different direction. They felt like they had some other things they wanted to prioritize. The CDC put the program into the archives. I happened to have my name on it. So it was an opportunity for me to kind of advance the strategy. And what I'm doing now is currently trying to advance that community health worker and violence prevention model, which identify people like myself, people who come from the crisis, people who are in close proximity to the crisis, getting them identified and trained to then come up with solutions to address the crisis. So that strategy is now defined as community-based public health response to violence. And our goal is to be able to deploy this across the country, leaning on the work that happened inside of Portland, Oregon, which is like, $1.2 million to invest. But the difference now is we're using community-based lens. It's from the community into the systems and across different communities. So that's kind of like the baseline of the work that I'm involved in.
That is fascinating and innovative. So, okay. And can you tell us a little bit about your biographical background and how you sort of naturally came to this work? You said you came from it and are of it. So. Yes, ma'am. Yes, ma'am. So,
so for myself, and this is really important to note, so the context for, especially for this particular platform, is I understand that, as a population of people, since we brought here into these lands, we've been hearing all the facts and all the data that shows the objective was to dominate and to exploit. Right. So what I like to make sure we highlight is that throughout all that domination and exploitation, people inside these lands, Africans as well as indigenous First Nations, have thrived. Right. At 400 years of slavery, after 400 years, within 10 years, African Americans are some of the most prominent politicians and prominent businessmen inside of our society, to the point that, certain populations, Europeans came in with guns, KKKs, and various other entities was formed to take that from us. Right. And even after that Jim Crow era, you had time frames with 1898, Wilmington, North Carolina, massacre, coup d'etat. It really came in and literally took resources, took people from political office. Same thing, 1920s, Oklahoma, Tulsa, Oklahoma. The point is, throughout all that, externally, the violence and the oppression was actually hitting us. But internally, we may have actually stumbled and had some challenges. We may have hurt ourselves, but it was never so rampant. It was never so comprehensive. It was never so overwhelming. I come into the equation in the 1980s, late 1980s, going into the 1990s, with something significant really changed. And that was the era of crack cocaine, which we know because of the United States' goal to stop communism from advancing throughout Central and South America, they allowed Contra, right, to actually sell cocaine into our communities. Ricky Ross, gave testimony to it. Gary Webb actually lost his life giving testimony to it. And that cocaine that was spread into our communities created an economic incentive amongst street gangs. Very simple youth hanging out, territorially connected by tribal connections. There was very little incentive to murder en masse. There was very little incentive to be territorial, to expand our territories. Once cocaine hit into our communities and then flipped into the use of crack, right? You created an economic enterprise that heightened the level of actual aggression and violence that was unprecedented for Blacks inside of America, hurting themselves. Now, the reason why that's important, because I inherit the second generation of that, right? Being born in 77, by the time I became 13 years old, early 1990s, right? That was a second wave of not only the crack era, which broke down the family and the community, because the preachers and the educators and the doctors free-based, and they ended up becoming the people we were selling drugs to. Now we got the guns in our hands and we got the drugs in our hands, and the people we're looking to, who used to be the village that can actually raise us, those individuals became the people we had power over, right? And that drug, not only did it actually create, this enterprise of violence, right? But simultaneously, Reagan in the same individual, that actually was responsible or was claimed to be responsible for the actual Contra scandal, right? Initiated a war on drugs. That war on drugs created the scenario of mass incarceration, which we heard the numbers about, right? But I'm here to tell you the direct experience of it. When you enter into prison, I enter into the prisons around, 17 years old. right? 8 years in California Department of Corrections. You're talking about the most violent place in America, right? When I say violence, I'm talking about, you know, interpersonal violence, I'm talking about sexual violence, I'm talking about hand-to-hand combat, I'm talking about the mentality of how you think in that environment, right? Governs you to become more violent and more aggressive, and it also traumatizes you. So you're talking about the mid-1980s going into the early 1990s. They coined us saying what they referred to as super predators. Understand me, when they actually referred to us as super predators, right? They was not telling us what they observed. They was giving us a clear example of what they was creating. Because when they was putting us into these prisons, right? 200,000 mid-1980s, by the early 1990s, you got 1 million. By the beginning of the 2000s, you got 2 million, right? And you got this factory of trauma. You got whole generations of actual leaders and potential educators and potential scientists being put into this environment, right? And not only is it the most violent place in the country at that time, right? The most racialized place in the country at that time. A white person was to eat from the plate of a black person before he left that yard, he would be stabbed, right? This environment, right, of trauma was then recycled back into our communities. And when I mean by recycle back into our communities, recycle within a geographic and a demographic concentration. How is that possible? Jim Crow, new Jim Crow, right? So the notion is, right, if I'm going to define you as less than human, because this is what slavery said, right, according to the Constitution, right, 3/5 of a human being, right? I can treat you as less than human, and I'm going to number you as less than human. Well, this is the justification of slavery. So when slavery ended, the 13th Amendment said that it shall be all forms of slavery and indentured servitude should be abolished except for, in what case? When one is duly convicted of a crime. So legally speaking, you're telling me that I have the legal right to treat you as less than human. That's the point. I have the legal right to treat you as less than human. So then now later, fast forward back to the 1990s, when I'm incarcerated and I'm being treated as less than human, when I come home, I also get denied the basic human rights of a human being. I don't have access to proper housing because legally I can tell you I don't want you living inside my property because you have a felony. So I'm not going to go live inside certain environments outside of what I'm used to. I'm going to go back to the same environment I came from, and I'm going to stay there. Economically, I can't get a job because legally I can tell you I can discriminate against you legally, right? Because you have a criminal background, you have a felony. So economically, I can't excel. I can't transition out of my environment. So literally I'm being caught and webbed into the same environment, and I'm bringing the trauma, right? And I'm bringing the violence back to that same environment, with the same inhibitions in terms of how to be able to actually transition socially and economically. And that trauma gets imposed upon our children. It gets imposed upon our women. I'm a product of that. Early 1990s, right? So when you talk about the work, you talk how I got into it, the work is about being in close proximity to the crisis. And because you have tasted it, right? We call it Imwalvalk. Imwalvalk is the knowledge of taste, not knowledge of actually third person narrative. I've tasted it, I've experienced it. Because of my close proximity, it's this population of people, not mine, but our generation, that has this ability to be able to understand how to navigate it, because the actual resistance, it hasn't stopped, right? In the same way that trauma is passed down from generation to generation, what we're noting, right, through the science of community-based, right, lens, that the resistance is also transitioned throughout the actual genes of human beings as well. So I hope to answer some of your question, but the point is that the very thing that we had to go through, right, in terms of crisis, is the very thing that comes back and actually challenges it. And I know the point here is not to talk about, for the jurists, not to talk about the solutions, but I think we all know what the actual problem is, right? And we're very clear what the problem is. But the reality is this, is that the way in which our society chooses to navigate, because it's chosen to say, I still can treat you as less than human. 13th Amendment, except, remember that piece, man, except, right? If I make an exception to why I can actually dehumanize you, right? Then this becomes a systemic behavior that's still present today. That's still present today.
Absolutely. The convict, I think it's referred to as the convict labor exception of the 13th Amendment or something like that. Michelle Alexander wrote about it in her new Jim Crow. Yeah,
absolutely.
Everything that it just creates a whole new, it transforms. Yeah.
But that takes it into, and this is the point I want to make. We're talking about genocide. We're talking about ethnic cleansing, right? We're talking about the intent to actually dominate and exploit. And if I'm not able to dominate you and exploit you and domesticate you, then if I need to, I will actually annihilate you, right? So the right to bear arms in the United States of America, right, and the right for a well-armed militia, which is a constitutional mandate, right, is for the preservation of power. So if I can't dominate you, if I can't keep you domesticated, then I will annihilate you. right? And this is the piece. What gives me permission? Well, because when I had a chance, when I went to war with each other, right, North and South, right, white folks killed white folks. They literally went to war and killed each other's brothers and sisters in order to actually change the system. They had an opportunity, my sister, Liana, and their opportunity was to change the behavior internally, to say that under no circumstances will we ever treat another human being as less than human. That document, 13th Amendment, states that they gave themselves permission to treat us less than human. And they will give themselves permission to act on that if they need to. And they're actually persistently showing us in their behaviors, all the statistics and all the data that we've been hearing, all the facts, environmental, police killings, mass incarceration, all these different charges is telling us that not only are they slowly willing to continue to maintain that behavior, but ladies and gentlemen, man, if they need to, they will expeditiously execute what they need to do in order to preserve the power, that they have. So that's the piece right there, is that the behavior, the systemic behavior hasn't changed. When they had the chance, they didn't leave it alone. They said, we have an exception to treat you as less than human.
So we have a
Absolutely.
question from the Chief Justice. So if we can just take
Yes,
a
ma'am.
moment and hear this question. Thank you so very much.
Yes, ma'am.
You have it on the phone.
Okay, guys. Oh, wait a minute, let me put on the, okay, okay, now.
We have an exception to treat you as less than human.
Okay, so we have a question
It's a delay.
from the Chief Justice, so we can just take a moment and hear this question. Hi, thank you so much, Mr. Abdul Hafeedh, for being for your testimony. It's really appreciated. My question to you, I've heard very in detail the emotion behind the trauma and the violence. Now, I want you to explain or to take us into from your expert experience or your diverse and extensive experience, the issue and the impact of mental health
Absolutely.
in respect of the consequences of human rights violations that have been installed through the system on mental health in respect of Black, Brown, and Indigenous people, and how you would want, whether through reparation or remedy, for the United States government to redress the issue. Thank you, sir. Thank you so much, Deputy Chief Judge.
And before
Yeah,
you
thank you so much.
respond, I just want to make sure you know we will have someone on next dealing specifically with mental health, but go on and respond as you see fit. Thank you.
Absolutely. You know, and it's all connected, and I appreciate that question. So to me, when I think about mental health, I think about toxic stress. I think about the breakdown of the actual immune system, right, and the breakdown of the central nervous system, right? And when we think about toxic stress, and we talk about stressors, we're talking about social determinants of actual health. We're talking about economics, we're talking about environment, we're talking about all the factors that contribute to why human beings either live a quality life, right, or they live a long life, or they actually fail to live a long life. And what we understand is this: for generations, if we talk about epigenetics, right, as we mentioned before, that generationally, this is inside of our actual blood, it's inside of our genes. And based on the environment that we're in, it's going to either activate, right, or it's going to allow that particular gene to remain dormant. And if you live in an environment, as we just explained, that is actually concentrating various forms of violence, various forms of inequities that actually hurt you and harm you, whether it's because you're hurting and harming yourself, right, because of interpersonal violence and aggression, or you being hurt by a system because resources are still not being allocated to you, that's stimulating this trauma. So the trauma is not necessarily just that which comes in the past, it's that's what's present. And when it begins to do so, right, stress is this thing, as we all know, that it can benefit you. Stress can cause a mother to actually move a car off her child, right, in that particular moment, that adrenaline. But once stress is overriding, once stress is overwhelming, it's like acid upon the central nervous system, right? So when you begin to see these behaviors, the super predators dynamic I'm talking about, right, this is the results of toxic stress, right? When a human being, out of desperation, begins to behave in a desperate manner, and they begin to hurt themselves, right? So when I'm thinking about mental health, right, I'm thinking about it from a lens of the very things that everyone's been talking about. All those things collapse upon that human being and incapacitates them from being able to be the best human being they can possibly be. And then what happens then is that a justification is made, right? And many times our own people calls for that justification. Many times our own people are asking for more law enforcement present in our communities to address the mental health crisis, right? Violence itself is a mental health crisis, right? When a human being loses the sense of sacredity for another human being, we're taking on the behaviors of our oppressor. And you ask about a solution, right? So there's a solution internally, right? And there's a demand for reparations. Of course, reparations is something that should be mandated, man, because it's about resources. At the root of this all, power is about resources. Who keeps it, right? And who doesn't have access to it? And everything that we've been talking about that happened to African and people that's indigenous populations is because of actual power and the control of resources. So resources should be an automatic thing. But in between time and in the meantime, the most immediate act that can be done to begin to restore this trauma and restore this population of people, or these people who's been deliberately tried to be broken, is to allow them to reconnect in a way that resources are given to them for programs. Evidence-based programs should be allocated to community-based organizations. Community leaders with lived experience, man. They should not continue to be exploited for their ideals and the things that they contribute, and allow other people with professional backgrounds take credit for their actual articles and take credit for their programs. But these people, these communities should be placed at the forefront, right? And they should be seen as experts because of their direct experience of the crisis and their ability to overcome the crisis by way of their resiliency.
So,
right?
brother,
That's an,
so my brother, Abdul, we have another question from the jury
Yes.
panel. And after you respond to that, student attorney Liana, if you can concise your remaining questions into a composite question for our witness to conclude with. So we have a question from the jury panels. Again, thank you.
thank you.
Good afternoon, Mr. Abdul. This is Bina Napram, one of the jury members.
Yes, ma'am.
And what you described, I think in the last 2 days we have been here, on bringing to this tribunal your testimony on narcotic drugs infusion into Black, brown, and indigenous communities, and guns is something which you have for the first time brought out very clearly at this tribunal. A phenomena that we are also noticed in several communities, marginalized indigenous communities in many parts of the world. My question to you are the following. These are what is called the technologies of killing. Technologies of killing, the chemicals of killing, which is done for committing this, which I call a slow death into our communities. The question that I want to ask again, we totally understood what you're sharing, but I would like to ask these following questions. What kind of drugs are flooding Black, brown, and indigenous communities in the United States? Who do you think are supplying them? And finally, what is the link between guns, drugs, and the destroying of our democracies, which is making us, as you said, 2/3 humans, half humans, or no humans at all, for which this tribunal has been convened? Thank you.
Thank you so much. That's an excellent question, and many answers in the question in of itself. The first question about the types of drugs. So first of all, the first drug is alcohol, just off top, right? The indigenous populations experience that, more deeply than anybody else, being inside, the reservations and being overwhelmed, right, with access to the alcohol and alcohol being pushed upon them. Alcohol is one of the #1 killers inside the United States of America. Some people may not want to hear that, but the fact is alcohol is placed more accessible to certain populations than other populations, right? Liquor stores, you go to the average corner store inside the average community, where it's predominantly people of color, African or indigenous, First Nations, Latinos, whatever you want to actually refer to them as, you'll find that those corner stores have more access to alcohol and access to sugar, may I add, than they have access to basic water, right? So alcohol is one. Crack cocaine, or cocaine itself. Cocaine is a drug that many people participate in, but very specifically crack in the 1980s and the 1990s, just because of the economic incentive that was made available to the common street hustler, was unprecedented in its impact on people of African descent and other indigenous First Nations. The drug that's now present today, and this is impacting everyone, but again, it's been impacting us since the 1970s when it was placed into our communities deliberately, which is heroin. What needs to be understood about these drugs, and there's other ones out there, you know, that they have nowadays called 2K, which is like an incense that's completely just doing all type of other things to the mind of a human being. But those are the main ones. Those are the main economically driven, and those are the main ones that's being made available. And where economics is associated, ma'am, to answer your question, is where you're going to see the prevalence of that drug be more prominent because it's money connected. And because the money is connected at that level, at one level of the game, race matters, and at another level of the game, it doesn't, right? Because the United States of America is an actual profit-driven society, and they're going to put the drugs inside here in order to be able to sustain themselves. When you say who, the people who are the power brokers in the society, right? There's people within government. Can I say all of government? No, but there's people strategically placed in powerful positions within government that understands the economic incentive of having drugs present, as well as being able to actually keep certain populations essentially sleep and essentially in a state of numbness, not aware of their condition, which is another form of trauma, right? Fight, flight, freeze, to be stuck, right? And the other one is appease. So the second question is people in powerful positions, whether they be government, whether it be corporations, right? If there's money to be made, then they're gonna have their hands in it, right? And they're gonna do whatever they can to make sure that they actually benefit from it. And politically and strategically, if it can be designed to keep people passive, keep people uninformed, to keep people unpoliticized, then it becomes an additional strategy that they actually use, because in our society, whenever you have a place like the United States of America who have international agendas, being involved in other people's countries and being involved and being the power broker for transnational corporations, you can't have an activated, intelligent population, because eventually they're going to question and going to actually challenge you in your activities. So drugs is a method of keeping them asleep. And then the last question I believe you asked kind of generates around, I believe, what was the third question, Sister Liana? I know it was, so it was the type of drugs, who's the power brokers, and then the last piece.
Yeah, it was about how do you think these are leading to acts of genocide, because this tribunal is on it.
Yes.
And yeah, that was it.
Absolutely. So, and that I thank you for the question, because it's important to put it for the record, right? But it's self-evident, right? When you're literally poisoning people, consciously poisoning people, right, with a drug or with drugs, whether for profit or for the purpose of keeping them pacified, right? You know, and science tells you that that drug is going to cause behaviors that cause these populations to inflict harm upon themselves, while simultaneously you're actually comprehensively inflicting harm upon that community of people. You know that annihilation is an inevitable outcome, right? And what we know is that, again, going back to the original statement, I keep honing back in on the 13th Amendment, is that there is a subhuman lens that's governing the way that this society is interacting with people who are not from amongst them, right? So if they're allowing drugs, and in many cases pushing drugs, and they know, like you mentioned, the guns are present and the drugs are present, right? And the scarcity of resources present. That formula right there is a formula for self-destruction. If at the minimum, not self-destruction, keep them displaced long enough to where if ever they get out of place, we have enough strength and capacity to do what we need to do with them in order to keep our power. I hope that answered your question.
Thank you so much. And I'll just ask you to close out with one last question I'm trying to formulate, which is, given the UN's Convention on the Prevention and Punishment of the Crime of Genocide, and in pertinent part, Article 2 and subsection B, which discusses the causing of serious bodily harm or mental harm, and given how this violence is carried out by the United States from police, law enforcement, overly surveilling our communities, harassment, the prison industrial complex, and then given your experience growing up in San Bernardino, subject to all these traumas, and then being incarcerated, subject to more trauma there, is there anything else that you'd like to share with the panel, those of us that, like on a micro level, kind of how you felt, very subjectively, how that sort of plays out on a field of bodily, mental harm?
Yeah, so the mental piece is the main piece. The bodily piece is secondary, but it's the ultimate result, right? You know, saying that you lose your life, right? But mentally is the main thing. And the number one thing I want to say to this body is that the number one attack on African populations and indigenous populations is their sense of actual connectivity to an identity, right? A connectivity to an actual legacy, a history, right? And the fact that as a population of people, we still even refer to ourselves as Black is problematic, right? Because it's an invention within a colonial condition. So having a lineage intellectually in terms of heritage that's pre-colonial, right? And having access to that is the actual foundational piece for restoration of mental and spiritual health. I'm gonna read this quote before I actually close out because I think it's important because it was the actual thing that restored me, right? You go from destroying your community to building your community, right? We're trying to find a way to help build our community because we understand we're in a condition where people have actually remained committed to potentially, annihilating us, genocide, right? And a primary resource, a primary instrument of support for us is going to be historical consciousness. And I'm going to read this quote from our Sheikh Muhammad Sharif bin Farid. And this quote is related to a concept that came from Sheikh Anta Diop, right? The Senegalese Egyptologist. And he says about historical consciousness, what exactly is historical consciousness? Collectively, it refers to a people's actual historical narrative. But more importantly, it refers to their attitudes towards that narrative. It answers the issues of the reason the creator created them and placed them in the circumstance that they find themselves in. The historical consciousness is a vital element of the original nature and the ontological indication of divine unity. The innate recognition of the oneness of the creator and the unity of existence results from the unification of the self, where the unconscious and the conscious are integrated in a symbiotic whole, where the individual sees himself or herself a part of a family, a social unit, a nation, and a universe which is connected and cohesively a part of an ongoing historical narrative. This is vitally important when trying to lay the foundations for historical consciousness, which is necessary for fusing the conscious with the unconscious and resolving the problems associated with slavery, colonialism, and domestic colonization, right? We as a people, if we remain in a state where we don't have a nation of our own, and the nation we're in is constantly telling us that it will get rid of us whenever they want to, and will slowly continue to try to deteriorate our existence, right? You're gonna remain in a state of poor health, mentally, spiritually, and physically. I appreciate you guys giving me the opportunity to share. I pray that this endeavor is one that translates into tangible results and opportunities to resist this nefarious condition. Thank you.
Thank you so much for your testimony. At this time, we'd like to move Mr. Hafeedh, Mr. Abdullah be accepted as a witness and that all the testimony be moved into evidence. Thank you so much.
Good to have historian Sheikh Anta Diop in the house, Sheikh. We're going to take a momentary break in the tribunal proceedings, not a break for you to go anywhere, but to explain a little bit about what's happening tomorrow and basically give a little announcement because there have been a lot of questions coming up. So as you know, tomorrow we're not here. We go to the United Nations. And that's important symbolically, but it's also important tactically and strategically because we bring this to the most recognized international space on the planet. What I'm saying about tomorrow, what's said in the booklets are a little bit vague. And so for you here today, but also for everyone via live stream, we're going to give a little bit more specifics now. So please take good care. We're going to begin the day at 12 noon at what we're calling a press conference. But that's a little bit of a misnomer. It's not exactly a press conference the same way Nkechi Taifa is not exactly a prosecutor. She's a people's lawyer. That's why that wording changed. And so really it's a press conference in a form, but it's really a people's conference. And it's the space where we will first and foremost hear from the 6 jurists who are with us and the 3 jurists who are not. So we expect all 3 of them, even though not in person. Some of them have already submitted some taped words, and others are going to do so after the proceedings today. So it's a chance, of course, first and foremost, to hear their executive summary verdict. What are the findings that they are going to, in their verdict, and we are going to, with them, carry on into the international governmental and non-governmental bodies that are before us in the world today? What is the essential evaluation that this independent panel of jurists have towards all of this testimony that they've heard and been presented in written and other forms. So it'll be a summary verdict. There'll be a more complete detailed verdict to come later on, but there'll be a summary verdict, and you'll get to hear from them about some of their own experiences and thoughts that drew them to that conclusion. At 12 o'clock, there's going to be that inside, indoors, and extremely limited in terms of number of seats. I'm happy to say that there are a couple of places left, and if some of you have the time and are confirmed and certain that you can be with us and you will be with us at 12 o'clock and want to be inside, please see me before the end of the day. And I have to warn you, unlike most days, I and the jurists and I will be leaving very quickly when the proceedings are over. So I wanted to say that now. So if you are interested and able and certain that you want to be inside, please see me. For anyone else who may come by at 12:15, and those of you who will be watching via live stream, we will be live streaming at that time. And there will also be, we hope, depending on weather, some outdoor space for people to gather. The gathering will be in front of the Church Center for the United Nations. That addresses the corner of First Avenue and East 44th Street. And you might be able to see it because there'll be a giant 18-foot puppet of political prisoner Mumia Abu-Jamal that will be out there, so you can't miss it. Also, right behind the words Church Center for the United Nations, and it is right on the corner of 44 and First. And for those of you who don't want to stand up for an hour and a half, just around the corner on 42nd Street between 1st and 2nd Avenue at the Church of the Covenant. Again, that's 42nd Street between 1st and 2nd Avenue, the Church of the Covenant. In their fellowship room, there will be enough space for all of you and a big screen, and that will be live streamed, as well as all the other places everywhere in the world that this has been live streamed for those days. And just to note our plan, at 1:30 at the end of this, for all who are able, those who are inside will come down, those who are outside with the puppet will meet, and that group of two together will walk around the corner to the Church of the Covenant, and we'll all be together for a final end of the proceedings, or end of the time together. The proceedings end today, the jurists' words end tomorrow officially at 1:30, but it's a time to be together on the street in front of the Church of the Covenant. So if you want to come by the Church of the Covenant, that's open, no need to register, you can go by, obviously on the street, but if you want to go inside, there are a couple of spots left, please see me, and we'll see all of you via virtually or in person tomorrow afternoon. Thank you.
So that was Matt Meyer with the Spirit of Mandela Coordinating Committee. We're going to continue with our final count, public health and equities. We just have a couple of more testimonies for you to hear. So we're going to now see via Zoom, live Zoom, Reverend Dr. Willard Ashley, who is a certified psychoanalyst. And his testimony will be directed by attorney Billy Wilkinson, managing attorney with the Howard University Thurgood Marshall Civil Rights Center. So as soon as we get them keyed up, we will hear from them. Thank you. So you may begin. Can you hear me, Attorney Wilkinson? Okay, Dr. Ashley can hear. Attorney Wilkinson, we cannot hear you. Is your volume turned up on your computer? She has disappeared. Okay, I think she should be rejoining hopefully momentarily. So this is when I do a poem. Now, let me sign. Does it seem like they're coming back on online? Tech. Attorney Hansford, are you in touch with Attorney Wilkerson? Okay, so let me know what's, are you able to bring them on board while I'm talking, or I need to be quiet? So my question is, can I talk while that's happening?
Can you see me or hear me now? Either one?
We can hear you.
Don't see you. And see you and see you now as well.
All right, I'm going to go ahead and get started because I apologize for that confusion. May it please the court. My name is Bilquis Watts Wilkerson. I'm the managing director and attorney at the Thurgood Marshall Civil Rights Center at Howard University School of Law here in Washington, D.C. It is my honor today to be examining Reverend Dr. Willard Ashley. Dr. Ashley is a professor at Rutgers University in his School of Social Work. He is a clinical fellow for the American Association of Marriage and Family Therapy. He also acts as trustee and faculty at the New Jersey Institute for Training in Psychoanalysis. In addition, Dr. Ashley is a certified psychoanalyst and a certified group psychotherapist and has worked with All Healers Health Alliance. He's a qualified expert to speak on mental health here at this tribunal, this international tribunal. Thank you, Dr. Ashley, so much for being with us today.
Thank you.
Dr. Ashley, what experiences stand out for you as a Black psychoanalyst?
It has been exhausting last 5 years, regardless of one's politics, just in terms of, and then more so the last 18 months, dealing with what I've been calling the quadruple pandemic. I wrote a piece for Yale University, the Divinity School, and I called it the double pandemic. And after I hit the send button, I realized I'd made a mistake. It really has been a quadruple pandemic. Clearly, COVID-19, systemic racism, violence, and partisan politics. And so as a Black psychoanalyst, it has been exhausting because people that never thought of therapy say, I need to see somebody, I need to talk to someone. Folks, you know, this whole thing about, you know, Black men are resistant to therapy. Guess what? After these last 5 years, they're like, I need to talk to somebody because this stuff, and that's the PG version, is wearing me out. And so it's been, I mean, good news, bad news. I left full-time academia, an academia part-time, full-time psychoanalyst, opened up my new office. And I mean, I'm having to add more days because people are just coming in and they're saying, I don't want the kind of surface kind of psychotherapy. I really want a psychoanalysis. I really want to deal with my unconscious. I really want to dig deeper. You know, you give me the techniques and I can do the techniques, but I want more than techniques. I want to try to understand, why am I feeling this rage? Why am I feeling this anger? And is it normal? And so one of the things that has been an ongoing conversation is saying, you know what, many of my other colleagues will pathologize what's a normal reaction to all the stuff you have been through. And I'm glad you're not self-medicating, at least that's what you're telling me. And that we're gonna have a conversation instead and look at some healthy ways to address this. And at the same time, as a Black psychoanalyst, making sure that I stay healthy and taking a look at self-care options and really trying to not put on COVID weight, or at least not any more COVID weight.
Absolutely. What are Black patients stating that their main reasons are to seek treatment?
You know, this has been curious. You have the DSM-5 and it has all the different diagnostic options, but people have been coming in with something that's not in the DSM-5. They've walked in saying, Doc, I'm tired of white people. And this has been consistent. Now, granted, probably because of how I advertise on Psychology Today and on Google, people feel welcome to come talk to me about that conversation. They look at me and say, okay, you teach at Rutgers, you're doing this nationally, internationally, so I feel comfortable saying it. But you sometimes, I don't like my brother or my sister, or I don't like, the in-laws, the outlaws, or Thanksgiving is coming or something. They are walking in, literally plopping down, body almost limp on my analyst couch or chair, saying either I'm sick of white people or I'm just exhausted from all the racism.
Could you share your experiences of racism and racial trauma as a psychoanalyst, pastor, and a graduate school administrator, also as a professor and in collaboration with All Healers Mental Health Alliance?
Well, All Healers Mental Health Alliance has been a godsend because it helps to normalize the day in, day out experiences of being a professional and wearing those multiple professional identities and asking the question, I know I'm crazy, but am I really crazy? And, being to say, well, again, we're being reminded that this stuff is devastating, it's exhausting, and it is crazy making. You expect people to treat you a certain way and it doesn't happen. And especially more so, the more acronyms after your name, before your name, et cetera, you expect a certain treatment that just doesn't happen. It's not consistent with how our colleagues are treated. There's this notion in the professional identities that you're presumed incompetent, that they assume that you don't know what you're doing, that you made it because of a quota or set asides or whatever. And that takes its form in many different ways, but it wears you out, having to always prove what you're not. I'm not a danger, I'm not a threat, I'm not incompetent, I'm not just here because somebody did you a favor. So having that conversation. On the other hand, the institutions saying, we realize there's a problem. We hire someone like you to come help us address the problem. Then they want to control it. It's like, wait a minute, if you could do it properly in the first place, you don't need me. So, why ask? And one of my good white friends, David Billings, said, Will, here's the deal. White folks do not mind talking about racism as long as they control the conversation. And so therefore, there's an implicit be nice racial contract. And in the be nice racial contract, we're going to let you know when you overstep your bounds and start to hold us accountable. And we're going to let you know when you start to make sense and you start telling truth and you're no longer buying the myths and the fables and the fiction. And so it takes place in many different ways. But at the end of the day, it's to control the conversation so that white people don't feel uncomfortable about what they've done and what they're doing and not held accountable. That's the end goal of it. And I'm in the process of beginning to work on a paper with a trusted colleague that's going to challenge this whole notion of white fragility. I don't believe in it. They're not fragile. But I'm glad my colleague is making a ton of money selling that and doing the seminars, webinars, but I'm going to say, they're not. When 4'9" Karen steps up to 6'2", 200+ Willard Ashley and is in my face and there's no police around, I'm like, wait a minute, so what made you think that you can jump up in my face other than that's the culture that you've been told that in the white supremacist culture, that it doesn't matter who I am, what I bring to the table or anything, that you as a white person have free license to jump up in my face. And granted, we don't hit women, etc. But I just can't fathom my brown, dark-skinned sisters jumping in somebody's face, telling them whatever, who they don't even know from a hole in the wall. So that, that has been, and that is kind of the challenge, and it's the culture, and it's permeated. And I see people are more aggressive, unapologetically. I see more road rage in various ways, both as a person, and I look at people. I was in Nashville, and I literally just did. My book was all of a month old, and I was in Nashville, and I had some white people approach and say, "Well, that's the end that wrote that book." And it's like, whoa. Well, I'm glad the book is making the rounds. I'm sorry that you feel that way about me, but okay, thank you.
Dr. Ashley, we have a brief question from one of the jurists. Please come.
Sure.
Thank you so much, Counselor and Professor, Ms. Vicky Casanova-Willis for the jury. I just have a quick question. As you speak about the messaging and the public health crisis of racism is how some people have characterized that. I'm wondering about your perspective on that. But in addition, I'm thinking about our children, right? The young people who are not a part of this tribunal or this conversation. And we've been struck by some of the things shared with us about the messaging that is going directly into their brains, which is from much of this ratchet music, the messaging that tells them what to do with some of the same rage, and it's turning inward, it appears, on the communities and contributing directly to acting out these instructions in the music about B's and H's and how to regard or disregard their communities. And I'm wondering if you have done any work or any reflection or have just an opinion on that dynamic of feeding messaging into the community that then is genocidal. Thank you so much.
Thank you for the question. Years ago, Chuck D, Bob Law, and myself met religiously at Abyssinian Baptist Church to talk about the messaging. We did a campaign, Stop the Negative Rap. We haven't picked that up since that time, but I remember having some really good relationships with Chuck D, having that conversation. And, you know, being a child of a different era, remembering when rap was positive and it wasn't negative, and recognizing. And so the counter message when I'm asked to speak to young people is that I need you to do your own research, because the very executives that are pumping your head with this stuff, guess what? Their kids not only go to college, they go to the Ivy League schools. The Benzes and the luxury cars, they're rentals. The jewelry, they're rentals. There's a guy standing right on the edge of the set waiting. The minute the shoot is over, it goes back into a case, goes into an armored truck and goes back to the place. So they're selling you a fantasy. And the fantasy is self-defeating. It works against your own self-interest. And so I have that conversation. I point our young people to say, you know, it's interesting. I'm angry as all get up that it took until this century, but I'm glad it finally happened, to have a movie that says that there were Black women that were called computers. Hey, wait a minute, that means they could do science and math. Holy crap. I've been told we don't do science and math well. Although I do say, well, how did the pyramids get built? And there's usually silence, but that's a whole nother conversation. So just to be able to say to our kids, you know, don't drink the Kool-Aid. And I don't like how you use the end result, but don't tell me you can't do science and math and you're a drug dealer. Okay? I don't like how you use it, but don't tell me you can't do science and math, and you do the metric system better than some of my college graduate folks. Okay? You understand chemistry in ways I wish you would use it different end, but you do get it. So, you know, sometimes you have to hear what people are saying and then take a look and say, but that's not reality. That's not my reality. But it's the same way that you and I get pathologized for reacting to what people have put before us. You know, we got hit and we said, ouch, and we're pathologized. But the person that threw the punch has no pathology put before them. We become the problem. So I try to talk to our young people about that. And other than when I get paid to use the word, and I do get paid to use the word, so I use the word, I've been walking away from racism as a word in terms of I've seen too many other groups now jump in and say, hey, racism, racism, racism. So I've become increasingly more comfortable with anti-Blackness. And I say that because obviously I'm fair-skinned, but have two beautiful brown, dark-skinned sisters. And outside of our home, clearly their experience was different than mine. In the process of writing my book, I was doing some fact checking. Say, you know, when we grew up and so-and-so happened. And I remember my baby sister almost to tears saying, well, but she didn't help us because we were too dark. And I didn't realize that. I felt embarrassed that I didn't know that. I felt shame that I didn't know that. But once she said it, it made so much sense that even within our own race, you know, we do this colorism stuff. And we do have this thing around light skin, fair skin, dark skin, brown skin. I mean, I have members of my congregation saying they're having a hard time trying to find a mate because of complexion stuff. You know, my hair is kinky and I don't straighten out my hair and I don't do, look this certain way and da 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 da. So it is a challenge. I believe that we have to continually invest in our children, encourage our children, and tell them whether you're a size this or a size or the other end of the spectrum, that you're beautiful, that you are going to make something of yourself, and that you are somebody, that you're a genius. And as Bruce George talks about, genius is common. Yeah, he's correct. That so many times that we relegate genius to the IQ, as opposed to the single mother that figures out how to feed her kids when the system is stacked against her, to the young men and women that are told by guidance counselors, you're not college material. And all of a sudden we find ourselves not only in college, but thriving in college. Someone got on my case the other day because I told them I had one regret. And my regret was that the 9th grade guidance counselor that told me I was not college material died before I could send her an autographed copy of my 4th book.
So I'm going to pull us back to the topic of genocide. Unless another one of the jurists had a question first, I'm starting to wrap it back up a little bit, Nkechi. Okay, so we spoke a little bit about the general topic is genocide. Genocide's been happening in the Black community since the Black community came to this country. But I know that you'd mentioned that you wrote a book, and you also started to talk a little bit about the last 5 years and the changes that you've seen, bringing the conversation of genocide, mental health into this modern conversation. Can you talk a little bit about why you wrote a book on a topic that Saul Alinsky made popular in the 70s, and how does that relate to the International Tribunal today? For those who are unfamiliar, Alinsky was called the prophet of power to the people in Time magazine and a pioneer of modern community organizing. And so really my question is there an intersection between community organizing and mental health, and how does that tie into our conversation today?
Sure, thank you. So there's three responses to community challenges. Let's take racism. You can do service, and I do service. I see people for pay for fee service. As an attorney, you see people, they litigate, they sue the company, they sue the organization. So that's the service piece. But there's this mobilization. That's what the Al Sharptons do. We're going to have 1,000 people show up. And we're going to storm the castle and let them know about our demands. Community organizing says, okay, through mobilization, you have the attention, you have a seat at the table. But now, how do you leverage your power to bring about change? And so sometimes people get it twisted. Well, we brought 10,000 people and they heard us, but nothing changed. So I'm glad you brought 10,000 people. That's wonderful. I'm glad you're on the major networks. You did the talking head shows. God bless you. What changed? I missed that memo. So community organizing takes us in the direction of bringing about change. And so you're correct. I do have an ego. I'm a Black Baptist preacher. I got that part. We're prone to narcissistic tendencies. I own all the above. However, I recognize that when Saul Alinsky wrote the book some 50 years ago, that although it's implied about racist things, it's not explicit. And so my book 50 years later says we need to have a conversation. It needs to be explicit. And you can't imply it. We have to come out front and center and name it for what it is, call it for what it is. And one of my colleagues, Barbara Major, kept saying, "Will, you need to author the book. You need to author the book. People need to hear. You need to name this stuff. You need to name this stuff and let people know." And so it's one thing to say that we're glad that we've made some strides. And yes, we can live some places we couldn't live. We can buy some things. We can do conspicuous consumption, all of those kind of things. That's wonderful. However, what has changed? whether it's 1921 in Oklahoma or it's any major city, what has changed? We had a Black president for 8 years. Okay, wonderful, but we're still dealing with, can we vote? We're still having that conversation. Our children are still being told that you're less than. And so organizing says that wherever you find yourself professionally and personally, that you can win, we can win. This actually is winnable. At the same time, it says, let's not be lulled to sleep. This is not new. We've seen the movie before. Sojourner Truth let Frederick Douglass talk and talk and talk. And then when he finally sat down, she said, I'm sorry, Frederick, is God dead? So this is not new. We felt this for. We had Reconstruction. And I'm always happy to mention my sister, Dr. Anderson, who wrote the book White Rage, which showed over the history of the United States that whenever Black people made strides forward, it was always followed by a period of white rage to take back all of those. So this is, again, it's look at read history, understand history, appreciate it. And you'll see like, wow, look at your watch. Surprise, surprise. You had Black people for 8 years. Now we got to take all that stuff back and push you back. So we have polite genocide now. Instead of hanging from a tree, we do it electronically. We do character assassination. Instead of hanging from a tree, we put out little rumor in your window in the attempt to dilute your power, to dilute your following, so that the minute you get woo-woo, you got too many folks listening to this person's making some sense. We got to stop that. So either if we can't co-opt you and buy you out, then we have to demonize you so people break away. So whoa, can't be around that. So yes, the genocide is real. It just doing it different ways. We're living a real live shell game. Turn your head that way and watch me switch around, and you weren't paying attention. We're being duped by magicians, by politicians and spin doctors, and unfortunately, we're drinking the Kool-Aid. I'm happy for those that are beginning to understand the difference between income versus wealth, and creating wealth, as opposed to saying, wow, I'm glad I have a 6-figure income. But we find out, we knew this, but COVID showed us, you can lose your 6-figure income like that. But wealth is a different conversation. In the midst of the pandemic, McDonald's was still doing franchising. In the midst of the pandemic, Dunkin' Donuts, et cetera, et cetera. But the challenge is, as Dr. Claude Anderson mentioned to us so many times in the past, go to any mall in America, name the Black anchor store. It doesn't exist. Go to any mall in America, name the Black retail chain that's in all the malls across the country. Oh, wait. It doesn't exist. For that matter, let's not push it, but for that matter, they got angry with Byron Allen for owning 3 cable networks and tried to boycott him in many ways. So, I mean, the genocide takes different forms, but it's still there. And COVID-19 showed us in ways that were very painful, a painful reminder. You can be a Black physician and say, no, I'm sick. And they send you home because you don't know what you're talking about. You can be Serena Williams, a well-trained athlete, #1 in her field, and say, something's wrong with my body. No, you get the Black girl treatment. And you say, wait, mommy, I think I know if I don't feel well, something's wrong. So again, the genocide takes a different form, but it's still very real. And not only through the body, but through the mind. Like the question came up earlier. How do you poison someone's mind that they no longer think that they're worthy of being treated with respect and dignity?
Absolutely. Well, Doctor, thank you so much for your testimony. Did you want to add anything before I submit your testimony to the record?
I just wrote an article. It's my academic article, and it's my reflection, if you will. It's in the Journal for the Advancement of Scientific Psychoanalytic Empirical Research, JASPER, and it's a reflection on healing the wounds of racial trauma in clinical practice, because I felt that my white colleagues don't always fully appreciate that how we approach this is different, that my patient's presenting problem is different than theirs. Person walks and says, hey, my brother got shot this morning, my mom's in rehab, you know, this one's like, whoa, you know, what happened? Just kind of basic, I don't like my in-laws or something. So we have a different presenting problem. We have a different people, like I just said before, you know, people saying I'm exhausted, you know, this racism stuff is killing me. So I felt that I developed a model that's a little different than what's out there, because you don't learn in grad school, for the most part, how to deal with racial trauma.
That is such an important piece. I'm actually looking forward to reading it. So I think that we should add that to the record as well. So we would like the record to reflect the testimony of the Reverend Dr. Willard Ashley, and entered into the record. We'd also like the record to reflect his book, The New Rules for Radicals, and his article, and repeat the name of the article one more time.
Healing the Wounds of Racial Trauma in Clinical Practice.
Excellent. Thank you so much.
Attorney Wilkinson, just hold on one moment. The Chief Justice might have a very brief question. Who's calling in from South Africa? Yes or no? I think we're going to release you, and we'll find out what the question is. We will present it to you and have you give a response that we can submit. Is that okay? Or
I mean, I can wait for a moment if that, I mean, my team is losing in the football game anyway, so. No.
She does have a question. Okay, there's a brief question here. I don't
Okay.
want to do this. Chief Justice, can you present? Oh, speaker. Okay, Chief Justice, can you submit your question for the witness?
Thank you very much. I hope that you can hear me. Thank you so much to the Reverend. Can you hear me?
Yes.
Okay, thank you very much to the Reverend. Can you hear me?
Yes, 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 you can be heard.
Okay, thank you so much to the Reverend as well as to yourself. I hope that I have an opportunity to present my question and tell it in full. My question revolves around the phenomenon that you have raised regarding the issue of what I refer to as generational color coding. Now, in my understanding, from analyzing the project of colonization, the complex of color was inherited as a result of colonization, and the prejudice of a lighter-skinned person as opposed to a darker-skinned person. Now, this has happened in projects all over the world and continues to reinvent itself. My question is, if amongst Black, brown, and indigenous people within the color complex created by white supremacy, how then, post-decolonization, do we quantify the issue of the color complex debilitating the confidence of Black, brown, and indigenous people for the purposes of a judgment for this tribunal? Thank you very much, Reverend.
And if your response can be as concise as possible, we will be deeply indebted.
Concise as possible. Okay, Black Baptist pastor being concise. That's an oxymoron, but I'll work at it. But first, I do have to say thank you very much for the question coming from you in particular. I was blessed by beating Nelson Mandela in his home, literally 2 weeks after his release from prison. He summoned myself and some of the Black preachers from the United States to say thank you for the work that we did. So I have an appreciation of South Africa, having been there and met with Nelson Mandela at that point. To be as concise as possible, the way that we get out of it is education. That we have to educate folks that this is not, this was, the way you just said it, it was constructed. And if it was constructed, it can be deconstructed. If it was done, it can be undone. And then as we educate folks to understand, there's certain words and certain phrases that we did not invent. They were invented to hold us back. They were invented to keep us separated. They were invented to keep us at each other's throat. And you're just as beautiful, whether you're brown, my complexion, or something else. And we come in all different hues, shapes, and colors, and we're all beautiful.
Thank you. Nkechi, are there any other questions?
No, there aren't. You can close this out, Attorney Wilkerson.
All right, we'd like to amend the record and add that last statement to the submission. Thank you again, Dr. Ashley, and thank you all for having us this evening.
Thank you.
Thank you. This is so very rich. And I'm just so very glad that the technology that we have today will allow us to go back time after time after time and look at and review and digest all of these very rich testimonies over these last couple of days. And I want to bring forward to take the witness stand Olga Sanabria, Puerto Rican representative to the United Nations, and directing her testimony on the Zoom will be Attorney Nkechi Mujahid. And we will continue as soon as he has been queued up. And those out there in Zoom land, if there are techie issues going on, it's all right, because you can see it again and again and again. And I'm going to look forward to it myself. You ready? After this testimony, we will have one last recorded testimony, which will be relatively brief, and then we're going to go into our closing argument for the tribunal. Yes. Attorney Nkechi Mujahid, you may continue. Your witness is on the stand.
Bismillah ar-Rahman ar-Rahim. Alhamdulillah. Alhamdulillahi Rabbil Alameen. Allahumma salli ala Muhammadin wa ali Muhammad wa ajil farajahum. Assalamu alaikum and good afternoon to everyone. My name is Nkechi Mujahid Fenwick. I'm an attorney, and for the past 15 years, I have been an advocate and supporter of political prisoners in the United States. At present, I'm the legal liaison for the Imam Jamil Action Network. I also used to be a public defender in the city of Philadelphia, the Commonwealth of Pennsylvania, and I currently work for an international public health organization in their opioid overdose prevention program. I'm honored to be before this esteemed panel, and I very much appreciate your attention. The right to health is a fundamental part of our human rights and of our understanding of a life and dignity. The right to the enjoyment of the highest attainable standard of physical and mental health is not new. Internationally, it was first articulated in the 1946 Constitution of the World Health Organization, whose preamble defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The preamble further states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, or social condition. The World Health Organization, along with the International Covenant on Economic, Social, and Cultural Rights, are two of the major international instruments for the protection of the right to health. Former President Trump began the process of U.S. withdrawal from the World Health Organization last year, where President Biden restored U.S. membership after his election. It is notable, however, that the U.S. has the dubious distinction of being one of only 4 out of the 171 UN member states that have yet to ratify the International Covenant on economic, social, and cultural rights, the other three being Comoros, Cuba, and Palau. The treaty was signed by President Jimmy Carter in 1977, but no steps towards ratification have ever been taken. In the US, the ratification process is that after the presidential signature, the US Senate ratifies the treaty by a 2/3 majority vote. That has not happened in over 40 years, and this is indicative of the United States' lack of commitment to the protection of the right to the health of its own citizens. At this time, I would like to bring the panel's attention to my witness, Ms. Olga Sanabria, who will be discussing the impact of US colonialism on public health inequities and human rights. Ms. Sanabria, would you please introduce yourself to the panel?
Thank you. My complete name is Olga Sanabria Dávila. I would like to clarify, first of all, that Puerto Rico has no official representation at the United Nations, and that I do work along with another team of people, and in the same manner that people in generations before me did work at the United Nations in order to ensure that international law be applied to the colonial case of Puerto Rico. I was born in Puerto Rico. I grew up in New York City. I grew up in a working class family, single mother with 2 children. I have dedicated many decades since 1969 to activism for the independence, for the decolonization of Puerto Rico. And in more recent decades, I have been dedicated to the international presentation of the colonial case of Puerto Rico, including at the United Nations. My work to garner support for Puerto Rico's decolonization and independence under international law has taken me to several continents and many cities in the Caribbean, Central America, and also in the United States. I have been a founding member of several pro-independence organizations in Puerto Rico that have spearheaded work on Puerto Rico on the international level. My educational background in New York and in Puerto Rico includes a bachelor's degree in journalism and a Juris Doctor. For many years, I've been active in my community in New York City. I've always maintained contact with my community in New York City. And I say that because I presently reside in Puerto Rico and I travel frequently to New York. And I've also always been active in many social and political issues in Puerto Rico, where I now reside, as I said before. At present, I am attempting to seek new ground in order to advance the case of Puerto Rico at the United Nations and internationally.
Thank you, Ms. Sanabria. Can you, at this time, please give a brief overview of the effect of US colonialism on public health inequities and human rights?
Well, the first thing I would have to say is that I do intend, I think that it's very appropriate, first of all, that the issue of health inequities in Puerto Rico and also in the Puerto Rican community in the United States be presented before an international tribunal, because the colonial case of Puerto Rico has to be addressed within the international community, within the United Nations, and also within the context of international law. And as this also encompasses violation of human rights and inequities in health in Puerto Rico and also in the Puerto Rican community in the United States, it's also appropriate for the case to be brought before an international tribunal such as this. Further, I would like to give a little bit of an overview regarding the Puerto Rican community in New York, in the United States, and also the historical background to the presence of Puerto Ricans in the United States. We Puerto Ricans are a Latin American and Caribbean nation. Our territory is located in the Caribbean. We're the major island of the Minor Antilles. And we forged a nation for more than 500 years in Puerto Rico. And so therefore we have the characteristics of a nation, and we have the sovereign rights of a nation, and we have the human rights of a nation, of course, and as human beings. Puerto Rico as a nation was invaded in 1898, and as a result of the impact of colonialism, there has been a massive migration from Puerto Rico to the United States, so that our problems with inequities in health are reflected not only in Puerto Rico, but they're also extensive to the Puerto Rican community in the United States, where at the present time, Puerto Ricans are 5 million. Some of the health issues that affect our people, our nation, both in Puerto Rico and in the United States, as far as health and health inequities, we have faced the problem of sterilization. We face the problems of the impact of environmental problems on our health. And we have also faced many of the other issues that are faced by Black, brown, and indigenous nations and peoples within the United States, and are impacted upon, and the Puerto Rican community in the United States is also impacted upon by domestic colonialism. Right now, we also need to speak about, when we give an overview on Puerto Rico and human rights in Puerto Rico, we need to speak about the present moment and how, even though Puerto Rico is a colony of the United States and Puerto Ricans are citizens of the United States. First of all, when we come to the United States, we're already citizens, but our citizenship, which was imposed in 1917, has made us unequal second-class citizens, so that even though when we come to the United States, we're already citizens, we're second-class citizens. And the way that plays out in terms of Puerto Rico and health inequities in Puerto Rico is that our health system is modeled after the United States health system, which, as we all know, is a profit-driven health system. And after the decade of the 1990s, health reform in Puerto Rico modeled the health reform that took place in the United States, which made the system even more profit-driven, in that it was possible for the healthcare insurance companies to decide what was the healthcare that was going to be provided depending on money, and what were the medications that could be prescribed, also depending on money. The other issue in health in Puerto Rico regarding inequities is the fact that the Puerto Rico health system is dependent on United States funds. And this creates much uncertainty in Puerto Rico regarding what the healthcare system will look like, which depends, as I said before, on this dependence on the funds from the United States. Further, it needs to be said that at the present time, with the economic crisis and the public debt in Puerto Rico, which I believe there's been a lot of information in the United States about that, there are extreme austerity measures that are affecting health in the country, and that reflect the dependence on Puerto Rico, and cutbacks on health benefits, besides cutbacks in workers' rights, in people's rights, cutbacks in education, close down of schools, cutbacks in pensions that are being fought at this very moment. With my presentation today and my presence here, my testimony in this international tribunal, I would also like to address the issue of the invisibility of the colonial case of Puerto Rico at the present time within the United States and also internationally. And to the degree that the Puerto Rican community has also been made pretty much invisible in this country, unless you have the fame and fortune of Jennifer Lopez, of Ricky Martin, of, what's his name? Jennifer Lopez's husband, right? You know who he is. Lin-Manuel Miranda, for example. If you're not those people and you're Puerto Rican, your issues and your situation and your colonial background is not likely to be known in the United States. So I think it's important also today that one of the things that I would like to also address within this international tribunal, besides the human rights violation represented by the colonial reality, represented by the inequities in Puerto Rico, including health, I also want to bring to the fore the problem of the invisibility of Puerto Rico and the Puerto Rico colonial issue. Finally, in terms of the Puerto Rican community in the United States, for many years, the situation of Puerto Ricans in the United States that were the product of the migration of the 50s, to a large degree mirrored the same problems, inequities, and human rights violations as the other Black, Brown, Indigenous communities in the United States. As I said before, even though we are citizens when we come to the United States, we share similar social, for a long time we have shared similar social indicators as our Black, Brown, and Indigenous communities. And in fact, in many instances, our social indicators are even lower. So that's something that we need to also make clear. But at the present time, where Puerto Ricans in the United States are 5 million strong, and where during the last 10 years, it's estimated that 300,000 more Puerto Ricans have migrated. The situation regarding our demographics is somewhat fluid. It still is to be seen what these demographics of this new Puerto Rican community will look like, because the social profile of this new wave of migration is somewhat different to the migration that took place in the 50s. So that's also an important point that I would like to make today. But generally, we need to also, one other issue that I wanted to bring out that I left out before regarding the present situation in health inequities in Puerto Rico, is that as a result of the present crises and also economic crisis, and also as a result of the health reform that has taken place in Puerto Rico, there's been a large component within the new migration of professionals, including medical doctors, and within that context, including specialists. So what that means is that at the present time, there's a shortage in Puerto Rico of medical doctors, of pediatricians, and of specialists in the medical field. And that's also an important factor within the present context in Puerto Rico and the health inequities in Puerto Rico. Finally, I want to re-emphasize, let's see, I think that would be where I would wrap it up for the time being, with the overview that that has been asked of me. Thank you.
Thank you, Ms. Sanabria, for that broad overview of the issue at hand. I'd like to ask you if you could bring it down to the local level, to the family level. Like, with all of these issues that you've outlined, what does that look like to individual families?
I'm sorry. I would be able to. I would like to be permitted at the present time to tell perhaps a little bit of my history as a daughter of migrant families during the Great Migration of Puerto Ricans to the United States in the 1950s. My mother migrated to the United States with my father in about 1953. They separated quite quickly, and my mother became a single mother of two in New York City, a recent migrant, factory worker, seamstress in the garment district, and low income, essentially. My mother became ill when she was 35 years old. She became ill with cancer, I was 15 years old, and from the age of 18, from the age of 15 to the age of 18, I took care of my mother during her illness. This was a time when health services in New York for Puerto Ricans were quite inadequate, as well as the school system was inadequate. There were no bilingual programs at that time. So this is generally a profile of what my mom faced. And I believe that her early death had to do with the angst of being a single mom, the angst of being a factory worker, the angst created by discrimination and racism, the angst created by what we call the colonial mentality, which is something that has been addressed before, and how the colonial mentality creates a self-perception of lack of worth, of not being smart, of your country of origin not having resources, being too small, not being able to be independent, a situation where we were not aware of our history, we were not aware of our culture and the value of our cultural traditions. And I believe that this colonial mentality and this oppression and this exploitation and discrimination that my mother was a part of, and which is a microcosm of the macrocosm in which Puerto Ricans lived at that time, were some of the factors besides the healthcare and putting off healthcare, because if she took a sick day, that was less money coming in. So all of these factors created a situation that led to my mother's early death. And when we talk about this and illness, we have to, due to health inequities, we also need to address how that impacts not just the person that's going through the physical pain of illness and not being able to work and not being able to generate an income, but also the impact of that on the immediate family, on the immediate community. And in my particular personal case, the impact of that on my early adolescence and on my brother's adolescence, and also in my future life. So I think that that's where I would leave my answer to the question regarding my personal story, I guess you would call it. But then the impact upon the community of the inequities in healthcare that impact upon the Puerto Rican community in the United States, I have to say that, again, there are commonalities between that situation of inequities and violation of human rights and the realities of other brown and of Black and Indigenous people in this country. And of course, we would have to talk about how this health inequity affects communities in Puerto Rico. And Puerto Rico right now has very high levels of diabetes, of mental health problems, of asthma, of obesity, and many of these have to do with the health inequities in Puerto Rico, but they also have to do with the internalized violence that has to do with the colonial mentality, the low self-esteem, and everything else that I described before. So that's an impact on the local communities themselves.
We have a quick question from the Chief Justice. Before you, Attorney Mujahid, before you continue, let's hear this question. Yes.
Well, I intended to turn the witness over for questions, towards the end. But if you think it's best that we take the question now, that's
well,
fine.
it's only because she's calling in from South Africa, and the connection is
okay.
We got to kind of get it when it comes.
I understand.
Okay, now. Go. Yeah, go.
I'm just gonna drop the volume. Thank you so much, Olga, Sanabria, for your testimony. I want to start by saying that apart from the fact that this is a tribunal of esteemed jurists, they are esteemed by the very nature of advocacy and human rights advocacy in particular also around the issues of decolonization and genocide. And in that spirit, as Chief Judge, I would like to officially pledge solidarity for the decolonization of Puerto Rico that is held in the clutches of the United States, and reaffirm that that international solidarity must remove the cloud of invisibility that shrouds justice in Puerto Rico. My question to you, and thank you for your commitment to the cause and struggle and your very extensive contribution, is how does this tribunal bring such individuals like Jennifer Lopez, etc., to the fore in the spirit of advancing advocacy? Has this been attempted? And is this a campaign that can be in the interests of the decolonization of the Puerto Rican people? Thank you very much.
I'm terribly sorry that the question, maybe because I'm too close, was somewhat inaudible. So I don't know if in the audience it was more audible, so that it can be repeated and I can try to answer the question. Also to say that I'm honored to receive a question from South Africa, and that I'm sorry that I really was not able to really understand what the question was.
The question was, how can you bring Jennifer Lopez forward into the...
How can, I'm sorry.
Advocacy for visibility of Puerto Rico was the question.
How can...
So, yeah. I think, and yes, it's hard to tell me, jurists, and if others have clarity. I think the general point is this: how can the work of the International Tribunal, how can this work help to bring more advancement to the causes of decolonization and the causes against genocide? I'm seeing some people shake their head no, and other people say right. Could you please come on up? It's not extra time, so people cannot hear, and people across the live stream.
How can you inspire and encourage celebrities such as Jennifer Lopez to become active with respect to their profile in terms of helping to change some of these issues and conditions?
Okay.
No, that's not it.
Okay,
that's not
so we're
addressed.
hearing lots of people say different things.
Can you come up to the mic and say how you interpret the question? I'm terribly sorry that I wasn't able to hear the question.
Yeah, I'm also sorry. And the coming up to the mic is not just about this, but people who are watching from around the world can't get any of this unless it's at the mic.
Oh, okay, my apology. For our Chief Judge, and thank you, Attorney Naji, sorry for the interruption. Thank you so much. I think what we heard was the very first part, and it was tough to hear. The very first part from our Chief Justice, Maggie, was compliments and appreciation and solidarity, right, for the efforts to ensure that, and we stand in solidarity, that's what I heard, with regard to the invisibilization and the continued pressure to resist the colonization of peoples, which is part of what this tribunal is all about. I think that Chief People's Lawyer Nkechi Taifa summarized the second part appropriately, which was pretty much just how best to elevate after this tribunal and incorporate the celebrity of people who do have platforms, like you invoked J-Lo, right? To be able to help bring this forward so that we can undo the genocidal trajectory.
Okay, I think that, first of all, I forgot Jennifer Lopez's husband's name, who has much international celebrity, and that's Mark Anthony, right? We all know that name. But regarding the issue of how to get other celebrities on board regarding this issue, I think it might be a matter of time before these international celebrities might become more aware and more active on this. We already have examples of that in the case of Vieques and Culebra, where, for example, in the case of Vieques, Ricky Martin was among many Puerto Rican artists that took a stand against the presence of the US Navy in Vieques and favored and demanded and demonstrated for the withdrawal of the US Navy from Vieques. So I think that it should be said that one of the characteristics in Puerto Rico is that regardless of the status option preference of the artists, generally the artists in Puerto Rico tend to have a very deep Puerto Rican identity, a deep pride in Puerto Rican identity, because this is one of the accomplishments, so to speak, of the Puerto Rican struggle, where even though at the present time we have not yet accomplished the independence, the total decolonization of Puerto Rico under international law, we have been able to maintain that identity, and we have been able to transfer that into the cultural sphere. So I think it should be said that many Puerto Rican artists already identify with Puerto Rico, the cause of Puerto Rico decolonization, and other progressive causes in Puerto Rico. As far as how to use this tribunal to further knowledge and consciousness and solidarity with the independence of Puerto Rico, the decolonization of Puerto Rico, the invisibility of Puerto Ricans in the United States, I think it's important what each and every one of you can bring back to your communities, to these struggles that you are all involved in. That's extremely important, because I think that has a multiplying effect. The other thing is that I think tomorrow's press conference, which unfortunately I cannot be there from the beginning, I'm very sorry. I just didn't know that it was tomorrow at 12 until recently. But anyway, tomorrow's press conference is extremely important. And of course, most importantly, is the decision of this tribunal as it addresses the inequities regarding healthcare and other issues for Puerto Ricans in Puerto Rico and in the United States, and in particular, a decision of this international tribunal regarding the need for the decolonization and independence of Puerto Rico under international law.
Thank you. Thank you for answering the Chief Judge's question. And thank you also for sharing such a personal story. And as you were sharing that, I was thinking about you and your brother being so young, and your mother being so young, and how in some instances that could really send kids the other way. Obviously for you, may have been a source of motivation to to take on the fight that you spent your life fighting, but it could send some people in other directions. So I wonder, and you also discussed the similarity between the Puerto Rican population and other peoples of color, indigenous populations, and their social indicators. I'd like to know, is the rate of alcoholism and substance abuse within the Puerto Rican community in Puerto Rico and stateside high?
Yes, I'd like to, if you allow me briefly before I answer that, do a continuation of my personal story, which is how empowering it was to me as a teenager in the circumstances that I lived after my mother's death, how empowering it was to me that this was the time of the Black Civil Rights Movement, of the activity and activism and radicalism of the Black Panther Party, of the women's movement, and of the anti-war movement in the United States, and of the activism, the radical activism in my own community through the Young Lords. So I was fortunate enough to become involved in that and become empowered by that, so that the situation that I faced personally did not squash me, but rather, because of the political ambiance at the moment, it actually empowered me. As far as the issue of substance abuse in Puerto Rico and in the Puerto Rican community in the United States, again, in Puerto Rico, we do have a huge problem of substance abuse, overdoses, incarceration because of drug trafficking. We have an issue also of criminalization of poverty, where we have a situation where oftentimes the places where controlled substances, drugs, etc., the places that are searched are the places where poor people and dark-skinned Puerto Ricans tend to live. So if that's the only place where you look for this, then your statistics are going to say that this is where this problem exists and nowhere else. But we know for a fact that the problem of drug abuse and overdoses and drug trafficking also exists within middle class, what they call in Puerto Rico, urbanizations, etc. So this is definitely a problem. The other part of what I would like to say is that the opiate crisis at the present time is also extending into Puerto Rico. Furthermore, and finally, the issue of drug abuse, drug overdoses, incarceration because of drug trafficking, also has to do with the ways in which oppressed people seek to relieve their pain. And oftentimes, of course, as we know, this quest for relief is sought in the form of drugs and alcohol. So in Puerto Rico, also in the Puerto Rican communities in the United States, we have that shared history with other Black and brown peoples. As I said before, the recent migrations of Puerto Ricans to the United States during the last 10, 15 years because of the new crisis, because of the climate catastrophes that we have suffered, we still need to see how the demographics of this new population within the United States plays out. So I can't say what the profile is regarding this problem within this new migration of Puerto Ricans to the United States.
You also discussed what I think would be fair to call a brain drain of Puerto Rican, doctors moving from the island, to the United States or perhaps other places. Is that void filled by, other doctors from other places who may lack cultural sensitivity, or is it filled at all, or is it just a lack of doctors for the population of Puerto Rico?
I don't believe that at the present time that void is being compensated. I don't believe that these health professionals, which are not just medical doctors and specialists, there are other health professionals that provide ancillary services. I don't believe that that void is being filled. So basically what you have is a population that's very ill, and that increasingly has difficulty accessing medical care and accessing appointments and specialized care in Puerto Rico. How this might play out in the future, what measures the government may take in order to compensate that, that's still not really clear at the present time. But it is not this void and this migration and this brain drain, which is, by the way, not just in the medical field, for the time being, is not being compensated. In other fields besides the medical field, where there's also a mass migration and where it also involves a brain drain and maybe professionals also included in this migration, there's also a void that is present in Puerto Rico. But it also needs to be said that increasingly, because of the fiscal control board that it was imposed on Puerto Rico, Puerto Rican institutions are actually being dismantled, so that professionals are leaving not just because of the economic situation, but because of the institutions that are being dismantled. And one example of that is an extremely important institution in Puerto Rico, which is the University of Puerto Rico. The University of Puerto Rico has had an outstanding prestige in the Caribbean and also within the Latin American and even in the international context. Prestige for academic excellence, for research, for publications, etc. But at the present time, as I said, the university, because of the austerity measures of the control board, is being affected, and that also impacts upon migration of professionals. And this is just one example that I'm giving.
And just so I understand, or so that we all understand the situation, you mentioned earlier that the U.S. or the health system that's in place now was imposed by the United States such that it mirrors the United States healthcare system, I guess, HMOs and things of that nature, that it's imposed, but it's also funded, but it's funded in such a way that there's a debt incurred, by the Puerto Rican government, and that with this debt that's been incurred and that's owed, these austerity measures are now taking place as a final result, such that access to other public systems or other public systems are being, defunded, underfunded, or undercut by those austerity measures, which, again, circling back, begins with the imposition of an outside healthcare system.
I think that the problem with the healthcare system and funding of the healthcare system has to do with the debt, but that discussion would have to be a separate discussion because of the complexities of that. But the health inequities in Puerto Rico have to do with the dependence on federal funds, and also with the fact that funding for healthcare in Puerto Rico is not depending on need. It's basically there are in different programs, which it's a complex system of funding, but in different healthcare programs, there are caps to how much Puerto Rico can receive, regardless of the need. So we would have to discuss particular programs, but the basic issue is dependence. The other problem is that, as you said, and I had also mentioned, the Puerto Rican healthcare system has been made to model the United States healthcare system, which is profit-driven. It's health for profit, which is not reflective of health as a human right. And besides that, the Puerto Rican people have never been able to have the power in their hands through independence, through self-determination, decolonization, and independence, of establishing their own healthcare system. And here it needs to also be said that historically the pro-independence movements have not just been pro-independence movements, they've been pro-independence movements that also aspire to a social and economic transformation of the country under independence. And presumably, in that context, we would be able to establish our own healthcare system under the premise of health needs and not health profits. But we've never had that opportunity.
All right, thank you. And just as that would require a larger discussion, I think everything that's been brought to the attention of the judges today would require further discussion to go in deeper and to understand all of the complexities. But at this time, I do think we're running short. But before we let you go, I'd like to know, is there anything else that you would like to add or to bring to the judges' attention?
Yes, thank you for the opportunity. I had said before, I would like to add a number of things, and they have to do with the problem of invisibility of the Puerto Rican colonial problem. So I would like to add some elements of Puerto Rican genocidal acts against Puerto Rico and Puerto Ricans, and also resistance. And they are specific instances that are not covered in the journal that was published by the tribunal. So I'd like to say in 1937, there was a massacre in Puerto Rico in the city of Ponce, where 21 persons were assassinated. It was in the context of a nationalist march whose permit to march was canceled at the last minute. And the police, the local police, attacked the marchers. And not only were there 21 people killed, murdered, and they were all nationalists and obviously independence advocates, there were also over 100 people injured. Besides that, in 1940, the occupation of Vieques and Culebra by the US Navy and all the implications that that had for the economic development and the health of the people of Vieques and Culebra. Vieques and Culebra are inhabited island municipalities of Puerto Rico. So you had the US Navy invade these islands that were inhabited and engage in target practice, military maneuvers within the waters and within the territory of these islands that are inhabited. And that was an act also of genocide. In 1948, in the area of resistance, the Puerto Rican Independence Party was founded. And that political party has its 75th anniversary this year. And this is a political party that has had the electoral scenario as one of the scenarios of its struggle. In 1950, there was an attack on the residence of the President of the United States. It was an armed attack. And one nationalist fighter was killed. And one nationalist, Griselio Torresora, was killed, and one nationalist fighter, Oscar Collazo, served 29 years in prison as a result of that action. And I'd also like to say that my colleague and comrade Wilma Reverón is the niece of Oscar Collazo. In 1959, the movement for independence was founded in Puerto Rico, and this was an extremely important movement for the independence of Puerto Rico, which had a broad organizational base and many different strategies in its program. And it also organized in New York City and other cities. In 1971, the MPI transitioned into the Puerto Rican Socialist Party, which was another political pro-independence organization that gained a lot of ground in Puerto Rico, an enormous political base, enormous strategy, and made tremendous inroads in the transformation of Puerto Rico. And that includes organizing within the United States. In 1973, the United Nations, adopted the first resolution reiterating the right of the Puerto Rican people to self-determination and independence under international law. And that would be Resolution 15, Roman numeral 15, which is a landmark resolution on decolonization adopted by the General Assembly. In 1974, the Puerto Rican Socialist Party called upon progressive and leftist forces in the United States to, together with the Puerto Rican community all over the United States, mobilize to Madison Square Garden in order to have an expression in favor of independence and the freedom of the nationalists that were imprisoned, that were political prisoners at that time. And Madison Square Garden on October 27th, 1974, was filled to capacity with Puerto Ricans advocating for independence, with United States progressive and leftist forces also advocating for Puerto Rican independence and the freedom of the release of the political prisoners. And it also reflected the participation in that of Puerto Rican artists and also many, many artists of the United States. I'm almost finished. I know we are short for time. In 1976, there was a mobilization, a massive mobilization of perhaps 70,000 people to Philadelphia, where there was a counter bicentennial regarding the independence of the United States in 1776. And that mobilization also called for the independence of Puerto Rico and the release of Puerto Rican political prisoners. That was also the year that for the first time the Puerto Rican Socialist Party participated in the elections in Puerto Rico. In 1978, there was a massacre of 2 young Puerto Ricans that were entrapped. Their organization was infiltrated. They were led into a sabotage of communications antenna in the center of the island. And when they arrived to carry out this action, the FBI and the Puerto Rican police was waiting for them, and they were massacred right there. And this had a tremendous, tremendous impact on the sensibility and the political consciousness of the Puerto Rican people. In 1999, 17 persons that had been accused of actions of the Puerto Rican Armed Liberation forces were released from prison as a result of the campaign that had taken place. In 2003, because the Puerto Rican people closed ranks behind the demand for the US Navy to leave Vieques, where the US Navy had already left Culebra. In 2003, the United States Navy left Vieques because of the struggle and because of the willingness of many, many Puerto Ricans, including, again, Wilma Reverón, who defended persons who engaged in Vieques Island in civil disobedience. So that in 2003, yes, the United States Navy withdrew, but that was the result of prison, civil disobedience, and also international support, and also support within the United States for the withdrawal of the Navy from Vieques, besides the Puerto Rican people of all ideological tendencies also demanding the withdrawal. In 2016, the Fiscal Control Board, which now controls Puerto Rican finances and is imposing austerity measures, was imposed on the Puerto Rican people, and this is also a genocidal act against the Puerto Rican people. In 2019, the Puerto Rican mobilized massively, including Puerto Rican actors and performers and singers of international fame. The Puerto Rican people closed ranks against an incompetent and corrupt governor, Ricardo Rosselló, who happened to be the son of the governor that in 1993 and on actually imposed the reform of the Puerto Rican health system, which has brought us to the present crisis. 2021, and also since 2016, the Puerto Rican people have constantly been mobilizing against the austerity measures of the Fiscal Control Board, and more recently against the privatization of the Puerto Rican Power Generating Authority. So that's another recent development that reflects our resistance. Generally, and to conclude, I need to say, and as reflected in what the journal states of the Puerto Rican struggle, resistance, and genocide, and what I have just summarized, that the Puerto Rican struggle for decolonization and the Puerto Rican struggle in the United States spans the spectrum of forms of struggle, from electoral politics and diplomacy to armed struggle. And finally, our struggles are waged at the mass level, at a base level, at the level of civil disobedience, elections, etc. And again, emphasize that our independence movement has historically been linked to social transformation in the United States, for the Puerto Rican community in the United States, and also in Puerto Rico. Thank you so, so much.
Thank you for your testimony, honorable members of this tribunal. That concludes the testimony of Olga Sanabria. I think what's undeniable is that the Puerto Rican people as a U.S. territory have not had the independence to address the public health needs of their population in a manner that they see fit. Rather, they have had a healthcare system imposed upon them which prioritizes the interests of the medical companies above the medical patients, and this has caused a cascade of deleterious effects. In total disregard for the right of the health denies their right to self-determination, in direct disregard of the UN Resolution 1514, which she mentioned, which affirms the inalienable right of the self-determination and independence for all peoples, including the Puerto Ricans. Thank you for your time. And at this time, I move that the testimony of Olga Sanabria be moved into evidence, as well as the journal which she referenced in her concluding remarks.
Thank you. Thank you very much. Thank you for such critical history. Thank you. Thank you. Thank you so very much. We have one last testimony, which is a pre-recorded tape of 12 minutes. And we were quite honored to close out our testimonies with Chase Iron Eyes, Lakota Standing Rock, living in Pine Ridge, and founder of the Lakota People's Law Project. I'm going to invite you, while listening to this final testimony, to just stretch at your seats, because immediately after that, I will go into the official closing statement, the closing argument from the prosecution. So we would like to plug in the pre-recorded testimony of Chase Iron Eyes at this point. Thank you very much.
Madakiapi, Chante Washte Nape Chuyus Papilo, Kola Iuha Ichicha, Leam Petki Lila Tayaya Hipelo. It's my privilege and honor to be with you today. I only regret that I'm not able to join you in person. My name is Chase Iron Eyes, and I am a citizen of an occupied nation known as the Ochet-Shakowee, or the Lakota Nation, or the Sioux Nation, as we're sometimes known in the treaties that we signed with the United States, in the international dealings that we've had with the British, other indigenous nations, the French, whoever at whatever time throughout the last, from Columbian contact, really. And, you know, it pains me to have to say the name of Christopher Columbus as we begin, you know, a new era of celebrating Indigenous Peoples Day. We're just coming off the heels of that. And just now, we're beginning to properly name the ongoing colonial experience that we are all having as genocidal, as holocaustic. Some disagree about the numbers of our people that were here on what we call Turtle Island, what is called North America now, or part of the Western Hemisphere. You know, we've had our ways of knowing these places and these waters and these sacred sites, and these places, waters, and sacred sites have had their way of knowing us for maybe you know, millions of years. We don't really know how long, but we have knowledge systems. We have, you know, epistemologies, cosmologies. We have a wealth of ways of knowing and ways of doing and ways of being that go back farther than the human imagination is capable of grasping. But since Columbian contact and since the imposition of foreign languages, foreign language systems, which come encoded with a way of knowing, a way of navigating, and a way of separating, really. When we're speaking of the English language, which is, it's a bastard, pirate, commercial language that is kind of, it's kind of like a virus, actually, if you think of it in terms of an operating system, you know, as a language, as an operating system, and in granting to the human species ways of coloring their universe, ways of interpreting and perceiving and expressing reality, or the unitive experience as indigenous peoples, indigenous nations, sometimes called tribal peoples or tribal nations. Again, there is power in naming. So I want to just preface, you know, include that in my introductory remarks, because when we talk about genocide, we cannot think to ourselves that this is something that happened during the time of Christopher Columbus only. Yes, it is true that not only did they genocide indigenous nations, not only did they enslave hundreds of millions of indigenous African peoples and nations, not only did they traffic in child sex slaves. Not only did they use vicious attack dogs and the most imaginably, conceivably brutal ways of bringing beautiful, strong indigenous nations under European Christian perpetual servitude, which is their edict or my edict if I'm a Christian European person who is unaware of the colonial programming inherent in colonial systems. We've got to take full stock and full assessment of the reality that genocide, colonization, racial and working class subjugation now by extension is not something experienced by our grandmothers and our grandfathers only. It's not something that was experienced by our ancestors. You know, when we think of our ancestors, we think of sometime back in the Stone Age or sometime eons ago. My grandfather was born in 1900. My grandmother and my mother went to these boarding schools, which are euphemistically called residential schools. But these were not schools in any sense of that word. These were concentration camps. These were torture camps. These are where my hair would have been cut. I would have been sexually assaulted. I would have been raped. My peers would have been assaulted, would have been raped for speaking their language, for expressing who and what the powers of creation had designed us to be. Genocide is very, very real for indigenous nations on a visceral level. I was raised on the Standing Rock Nation, the Standing Rock Reservation. I now live on the Pine Ridge Reservation or the Oglala Lakota Nation, and I would refer you to inquire about what happened at Standing Rock just 5 years ago when I was charged with inciting a riot and I was facing 6 years in prison, to learn how genocide for us has only shifted forms. The Indian wars have not ended. They've only shifted theaters. So when we had to defend ourselves against the colonial, extractive, foreign policy and energy policy of the United States, which is illegally occupying our land and coming to our front door with these massive tar sands pipeline projects, you can see quite clearly that the Indian wars have not ended, that it is still the stated and unstated, the unwritten policy to bring about the genocide, the eraser of the indigenous nations here, which welcomed all of the outsiders, all of the foreigners, and which to this day are still reaching out with an open hand, with open arms, saying, look, we have much to learn from each other. There has never been a truth telling between all of the cultures, all of the demographics that now find themselves inside our country, our territory. Let us show you how the land can love us. Let us show you the waters and the sacred sites which have imbued us, we the indigenous nations, with a worldview, with a cosmic order, with a way to anoint ourselves, with a way to make sacrosanct our realities. That way of going about in the world, which has been stolen from all of us, not just the indigenous nations on Turtle Island, but everybody around the world, especially those who are descended from Christian European peoples. and nations. All of the colonial process, the colonization of the spirit and the mind, the abstracting, the removing from our daily existence, this relationship with our surroundings, with our sacred sites, with the land itself, with the waters, with the heavens, with the cosmos. That happened thousands of years before Christian Europeans, the Brits, the Spanish, the Portuguese, others, the Dutch, whoever else arrived here on our land. That colonial process and that separation of the spirit from the mind, of meaning from labor, that system, which now is expressed in a financialized colonial extractive model that perpetuates racial and working class subjugation. Remember, I mentioned the doctrine of discovery. This is the stated purpose. The Christian European tradition says that indigenous, anybody outside of the Christian European demographic, is Saracen. They are pagan, they are barbarian, they are savage, they are uncivilized, they are impediments to what I consider progress, which is to put the human species on the precipice of a extinction level event, of a ecological collapse, unlike we, the human species, have ever seen. So I want to say to you all today that I extend my genuine, heartfelt gratitude for your willingness to be in this space and to fight for your very right to pursue a sacred way of life, because that is not what the powers that be have intended for us. And we are able now to graduate from, to liberate from these classification systems, which have kind of caused these very painful dynamics in terms of racial and working class subjugation. I want to end by just again telling you thank you. It's my regret that I wasn't able to be there with you today. I would urge you to connect with me online. I've got my own podcast. We're about to launch something new and unannounced in January of 2022. But again, thank you all for coming together. Thank you all for seeking our collective liberation and recognizing that our destinies are bound up in each other. Lila wopila tanka e chichapelo mdakuye oyase. Thank you.